All right. Hello, dear students. Hope I'm audible. First, let me just check the audio. Mhm. Hello. Hello. Yes. Yes. Perfect. Perfect. So, all right. Welcome to this session of our PYQ discussion. So, in the previous year question discussion, so first of all, before getting into the previous year question discussion, so just let me check with you people. So the first thing is that many have been asking me, sir, how about the subjects with subjects? So I have combined all the basic subjects. Okay, that is the first thing. So all the basic subjects means your paper one subjects majority. The three major subjects combined here will be biochemistry, pharmacology, and pathology. Okay. Now among this discussion, what we are going to do is that, see, there will be one question. The same question might have asked previously 3-4 times. Okay, so I'm not going to get into the repeated question, but the question which are asked about what is that? See, it was asked last year also, previous year also, before that also. So that will be one question, right? So like that only we are going to discuss. And the next thing which I would like to tell you people is, see, whatever I tell you in this discussion as the important points, focus on those points. Okay. Now, anyways, from our AFMG side, you'll get what is that? That is your notes will be given. But I don't think you, depending upon these notes right now, is good thought for you people. So for you people, what I would recommend you is that do not force yourself or confuse yourself by going through everything again and again. So I am here to teach you people at once. So we are just about how many days? 4 days before the exam. So basically we have strongly 2 to 3 days left. So among these 2 to 3 days, what you are supposed to do is that I'm going to solve these questions with you people. Learn them here only, and remember and finish it with that. Okay. So that is the first thing. Now these questions are, sir, how about the question? So these questions are reconstructed from the students. Okay. So from the previous year student, based on that only I have collected. So this is not something we have created this question or not something like that. Okay. So with that much being said, I will do, and one more thing, remember here, I will do the discussion, agree with you people, but along with the discussion, what I'm going to do is that I'm going to tell you this can be asked, this can be important. So those points, you have to remember it right now. And if I tell you to repeat, sit there and repeat in your room. Okay. So that much, is that okay for everybody? Hi, Anna, to batao. Yes. Shall we start? So, so with this much being said, let's start with the first question. The first question answer. I want to see the answer. So what is the answer? Let's discuss first. Let's start with the question. Insulin stimulate glucose uptake by the cells via GLUT4 is the example of. Okay. So it is an example of what? So what they're asking you is that, so if there is a cell, now if we give glucose, glucose will be taken up by the cell with the help of one hormone called as insulin. All of us know that. So for this insulin uptake, what we require is glucose transporter 4. Very good, very good. The answer is D. Okay, so glucose transporter 4. Now, glucose transporter 4, GLUT4, works by which mechanism? It is an example for my dear students. What is that? Facilitated diffusion. That is the last option. Okay, now, if you talk about a glucose transporter, so you need to remember 2 points. What are the 2 points? Glucose transporters can be of two types. One is GLUT, glucose transporter. One more is SGLT, that is sodium and glucose transporter. Remember, sodium glucose transporter is an example for secondary active transport, and this is an example for a facilitated diffusion. So remember, secondary active transport is by what? Glucose transporter, that is your SGLT, not GLUT. Facilitated diffusion is by the GLUT. Okay. Now glucose transporter, among which the answer is D. Agree with you people. So we have glucose transporter 1. One is located in the brain and RBC. Glucose transporter 2 is located where? It is located in your pancreas. Okay. Glucose transporter 3 is located on the neurons. Glucose transporter 4 is located in the adipose tissue, skeletal muscle, and as well as liver. And glucose transporter 4 is a insulin dependent. dependent. Okay, so this is the story of your first question. So that is your insulin stimulate the glucose uptake by facilitated diffusion. Okay, if I tell you people glucose uptake of the insulin by SGLT, if I give you instead of glucose, if I give SGLT, then it will be your secondary active transport. Clear everybody? Clear? So this is very important. So earlier, what are the questions which can come from here is glucose transporter 1, 2, 3, 4, whatever they are there. So their location, SGLT1 location, SGLT2 location, and their mechanism, that is your facilitated diffusion. Okay. Okay. Most common macrocytic anemia in India. In India. Okay. Now the problem here is that, see, there are multiple causes for macrocytic anemia, but among the given options, let's discuss. Okay. Sideroblastic anemia. Sideroblastic anemia, my dear students, it can be both. It can be both microcytic and also macrocytic. It can be both microcytic and macrocytic. Thalassemia exclusively microcytic. Thalassemia exclusively microcytic anemia. Now, chronic infection. Chronic infection leads to anemia of chronic diseases, which is a type of iron deficiency. Which is a type of iron deficiency. Now, when we're talking about iron deficiency, so it is going to be which type of anemia? Microcytic anemia. So the answer will be your alcohol related. So this is a classic technique to rule out, the wrong option. Okay, so here what they told, macrocytic anemia, but sideroblastic anemia can be both micro and macrocytic. The answer will be C. Clear? All right. Let's go to the next one. A boy with a black discoloration of the eye, skin, and ear pinna. Okay, his urine also turned black at the room temperature. Remember, urine is turning black at the room temperature. I taught you people in the classroom as well. If there is, what is that? If there is urine exposed to air, and if it is turning black, that is a diagnosis of what? That's a diagnosis of alkaptonuria. So the answer will be, what is that? That is due to homogentisic acid. So this is a diagnosis of alkaptonuria. Alkaptonuria. Very good, very good, very good. You people, Dr. AM and Raj, both are correct. Okay. So alkaptonuria, urine, if it is exposed to the air, it will turn itself into black color, and the answer will be homogentisic acid. Homogentisic acid. The enzyme deficiency, that is the enzyme deficient here is homogentisate oxidase. Homogentisate oxidase is the enzyme deficient in alkaptonuria. Clear? Okay. Let's go to the next question. A patient presented to OPD with the tendon weakness, okay, ataxia, and a history of one episode of unconscious, likely vitamin deficiency that might have caused. Okay, now he is having an episode of unconsciousness. It is a symptom of central nervous system, and there is a loss of balance and weakness. Okay, remember, all of us know one thing, one mnemonic called as GOA, right? So that is global confusion. Global confusion. Okay, then ophthalmoplegia, okay, and also you are going to have one more thing, ataxia. Okay, now this ataxia and global confusion, this global confusion can go into unconscious also. Global confusion can end up into unconscious. So what will be your answer? So there is a weakness, okay, there is a ataxia and history of unconsciousness. So the answer will be deficient vitamin will be what is the deficient vitamin? Come on, the answer is very good answer. The answer is thiamine. The answer is what? Thiamine. The answer is what? Thiamine is the correct. Very good. Piyush Yadav and Raj, both of you are correct. Okay. So remember, vitamin B1 deficiency. B1 deficiency. B1 deficiency leads to what? Vitamin B1 deficiency leads to what? Leads to a disease. What is that? That is your Wernicke's encephalopathy. Wernicke's encephalopathy. The clinical features are GOA. Okay, so this Wernicke's encephalopathy, it is a deficiency of B1, B1 in which patients, my dear students? In a alcoholic people. Okay, so alcoholic people. So the treatment will be thiamine supplementation That will be the answer. Okay, so that is the story of your what? That is your second question, thiamine. Okay, Thiamine. Majorly, we will give thiamine. Thiamine followed by glucose. That is based on the necessity. Okay. But major treatment here is thiamine. Okay. Don't depend upon the glucose alone here. Okay. Which of the following would inhibit the complex 4 of electron transport chain? So electron transport chain has complexes, complex 1, 2, 3, 4, 5. Okay, so complex 4 inhibitors, complex 4 inhibitor. This is also a very, very favorite previously asked question. Okay, so complex 4 inhibitor, all of you know the correct answer. What is that? That is your cyanide. Cyanide, and also your carbon monoxide also inhibits your that is your complex 4. So these two are what is the answer? Cyanide. Okay, now we have complex 1. Complex 1, what is complex 1 also called as? Come on, from the classroom, tell me. NADH dehydrogenase. Okay, complex 2 is called as FADH dehydrogenase. Okay, so that is electron transport chain complex 4. Remember, this complex 4 is a very, very favorite question of exam. Okay, very good. That is your roten. So, in fasting state, secretion of glucagon aims to produce glucose mainly by water. So, what they're asking is, so if they were fasting means what will happen? So, fasting means there is a decrease of blood glucose. There is a decrease of blood glucose. If there is a decrease of blood glucose, what will happen, my dear students? Glucagon will be produced. Now, glucagon. Okay. Now, glucagon, they're asking you how will it increase the glucose? It will increase the glucose. How exactly it will increase the glucose? So, it will increase the glucose by doing two things. What is that? That is your gluconeogenesis and glycogenolysis. Glycogenolysis means glycogen to, very good, glycogen to glucose. And remember, gluconeogenesis means formation of glucose from the non-carbohydrate source such as amino acids and also your fatty acids. So this is the non-carbohydrate source creating the glucose. We call it as a gluconeogenesis. So glucagon increases both gluconeogenesis and breakdown of glycogen. That is how it is increasing the blood glucose levels. Okay. So this is one question which is a very unpredictable question and which can be suddenly asked and very rare. Okay, so this is the thing, wildcard entry type of question. So if you get this question, very very good afternoon. If you get this question, तो आप लोगों को मैं पहले से ही बताता हूँ, ऐसा ऐसा क्वेश्चन मतलब कभी सुने ना हो, कभी मतलब एक क्या चल के आ रहा है, ठीक है, तो डरो। तो क्या करना है, उस टाइम में जो मतलब आप पढ़ के गए थे आप प्रिडिक्ट नहीं कर पाओगे. सो देयर विल बी वन और टू क्वेश्चंस फ्रॉम ईच एंड एवरी एग्जाम. सो यू विल फेस दिस सिनेरियो. सो दैट टाइम व्हाट यू आर सपोज्ड टू डू इज दैट इफ यू डोंट नो द आंसर, मार्क द व्हाटएवर यू फील गुड अबाउट it. Okay, whatever you feel good about it, mark it and come back. Don't waste your time on thinking. Okay, so that is the purpose I have kept it here. But this question which was asked and it became very popular. So what is a what is a hexokinase produced from the hypothalamus? So hexokinase is an enzyme which will convert glucose to glucose 6 phosphate. Glucose 6 phosphate, that is your hexokinase. That is your hexokinase. Hexokinase is the enzyme which is of what is that? Which is present in the glycolysis pathway. Okay, glycolysis pathway. Now hexokinase is present in tissues. So all the tissues will have hexokinase, and in the liver, the same function is done by one more isoenzyme called as glucokinase. Now this glucokinase, what will can happen? It's insulin. What is it? Insulin increase the activity of glucokinase. Increase activity of glucokinase. Okay, so this is glucokinase is present in the liver. Hexokinase is present in the other parts of the tissue. In other parts of the tissue, hypothalamus, you're absolutely correct. You people have done a really good job of preparation. That is your hexokinase 4. This is a point to be fact directly remembered. So hexokinase कहाँ पे आता है? Glycolysis pathway में. Where does the hexokinase comes in? Glycolysis pathway. Glucose will get converted into glucose 6 phosphate. That function is done by your hexokinase. Okay. Chalo, let's go to the next question. Patient was diagnosed to suffer from the carcinoid syndrome with association of heart disease. What is the active metabolite released in the urine that would have helped in diagnosing the carcinoid syndrome? Okay, आप लोग already previous year question solve किए हो तो ठीक है, but this question, what exactly is that? I want to teach you people about what exactly is carcinoid syndrome and what happens here. That is what I want to make you people understand. Okay, so come on, tell me the answer, then we will go to the next discussion. चलो आंसर बताओ पहले. Very good answer. B is not correct answer, but good try. Very good try, but not correct answer. I will teach you people first what is carcinoid syndrome. यही तो दिक्कत है, हम लोगों को क्या करते पता है, बस ऐसे हाँ भगाओ भगाओ ना यार, आराम सुनो. Carcinoid syndrome is what? Very simple. Carcinoid syndrome is a tumor. No, not even A, my dear student. Good try, good try. After this, after today, you will not make a mistake of this one. That is my guarantee. Okay, चलिए देखते हैं carcinoid syndrome होता क्या. Carcinoid, it is a cancer-like growth. Cancer like growth, cancer like growth. Okay, now a cancer like growth usually present in the liver and ileum. Okay, commonest sites are liver and ileum. So the answer is not even D. Only answer, correct answer I got so far is C is the correct answer, but we will talk about it. So in the liver, it is a cancer like growth. This with cancer like growth, what it will do is that it will release, my dear students, remember, it will release somebody called as serotonin. What is that? Serotonin. Okay, serotonin. What is serotonin? Serotonin is also called as 5-hydroxytryptamine. 5-hydroxytryptamine. Okay, now this hello Ajit, how are you? So 5-hydroxytryptamine. Now this fellow 5-hydroxytryptamine, that is your serotonin, that will undergo metabolism by the help of amino oxidases or monoamino oxidase enzyme, and it will create a 5-hydroxy indole acetic acid, indole acetic acid, 5-hydroxy indole acetic acid. Thank you so much, Bharat Kumar. Thank you so much. Okay, 5-hydroxy indole acetic acid. So what I'm trying to tell you is that, so in the patient who is having a carcinoid syndrome, cancer like growth, so they will have increased level of what is that? Serotonin, increased level of serotonin. So that means there is an increased level of what is that? Very good. That is 5-hydroxy indole acetic acid. So what I'm trying to tell you is that in a carcinoid syndrome patient, well, they will have elevated level of serotonin. Sir, what will be the clinical feature here? But the clinical feature, what can happen? Serotonin is elevated. Serotonin causes vasodilation of the small vessels, leading to what? So it is a small vessel vasodilation, leads to something called as flushing, and a very good answer, flushing, and it will also cause a mitral valve prolapse. What is that? Mitral valve prolapse. Okay, so this is the story of your, what is that? A mitral valve prolapse and flushing associated with the carcinoid syndrome. So diagnosis के लिए, further diagnosis, we can use what is that? A 5-hydroxy indole acetic acid. Why? Because if serotonin is more, automatically it is telling me what is that? A carcinoid syndrome. So serotonin is more, so more level of 5-HIAA. Okay, now what is this VMA, vanil mandelic acid? My dear students, this is called as VMA, vanil mandelic acid. It is increased in most important, remember, B12 deficiency. It is not increased in the carcinoid syndrome. Okay, the answer is what is that? That is VMA. Sorry, sorry, not B12 deficiency, sorry, that is MMA. It is increased in pheochromocytoma. I'm sorry, pheochromocytoma. Okay, VMA is increased in pheochromocytoma. Very good. The answer is pheochromocytoma. VMA is increased. MMA is increased in B12 deficiency. MMA, methyl mandelic acid, is increased in B12 deficiency. Okay, so sir, which one we can expect? The among these, remember pheochromocytoma, MMA, and 5-HIAA. Among these three, one is a short question. Be prepared with it. Okay? Done, sir? Okay. Let's go to the next one. Let's go to the next question. See here, the thing is that I'm not mixing Hindi for a reason, because we are very close to the exam and multiple students are watching from all over India, like multiple places of AFMG students are watching. So that's why I'm combining purely in in your, what is that? In the English only, okay? A post-menopausal female presented to the OPD with a sudden abrupt swelling of metatarsophalangeal joint after consumption of alcohol in a party last night. So after alcohol in a party, she is developing sudden swelling of the toe, swelling of the toes, that is toe joints, okay? So physician on duty prescribed a medicine for the same. Which of the following enzyme would have been inhibited by treating in this condition? So answer is very good. First we need to make a diagnosis. What is the diagnosis? She is having a gout. She is having a gout. So what is the answer? Xanthine oxidase. Xanthine oxidase, okay? Now please listen to me. Please listen to me here. I want to tell you people. So we have one of the most important. We have an acute gout. We have an acute gout and we have a chronic gout. We have a chronic gout. Okay. So gout can be divided into acute and chronic. So acute, sudden onset of pain. Sudden onset of pain. Sudden onset of the pain and swelling, etc., etc. Here, if they ask you, do we give allopurinol, xanthine oxidase inhibitor? Remember, allopurinol is absolutely contraindicated. So please remember, allopurinol is contraindicated in the acute gout. In the chronic gout, drug of choice is xanthine oxidase inhibitor, allopurinol. Allopurinol. So what I'm trying to tell you is that in the chronic gout, you give allopurinol. Here, sudden onset if it is there, okay, that time which is contraindicated. For the acute gout, the drug of choice is NSAIDs. NSAIDs. If NSAIDs is not there, the same characteristic drug, we have a drug called as colchicine. Colchicine. Okay. So that drug is colchicine. It is a chronic but develops acute due to alcohol. See, that's what I'm trying to tell you. For the chronic treatment, we are supposed to give allopurinol. So now, so patient is taking a chronic treatment for the chronic gout. Now suddenly, because of alcohol, because of excessive amount of meat intake, that can lead to sudden flare up of the gout. We call it as an acute gout. Okay. Okay. Now remember, this is the answer. What is that? Xanthine oxidase. Okay. So that the answer is xanthine oxidase. Let's go to the next question. Peripheral conversion of T4 to T3 is done by. Tell me. Peripheral conversion of T4 to T3 is done by. So in the blood, all of us know that in the blood. So in the blood, normally, physiologically, T4 is more than T3. All of us know that. Now, in the blood, what can happen is that T4 will get converted into T3. T4 will get converted into T3 with the help of an enzyme called as deiodinase. Deiodinase, I will write it as a D. Okay. Now, remember deiodinase. D1, there is D2 and D3. Isoenzymes. Deiodinase. Deiodinase will have three isoenzymes called as D1, D2 and D3. Now in this D1, D2 and D3, my dear students, remember what happens is that D1, D2, D3, they will create one of the most important thing. What is that? My dear students, D1 will create both T3 and also it will create something called as RT3. Okay. D2 will create only T3 and T3 will create only RT3. Okay. RT3 means reverse T3. Reverse T3. RT3 is useless. RT3 is useless. Okay. So remember, one of the most important enzyme to be remembered is deiodinase. It has a subtypes. Okay. Let's go to the next one. Okay. Which of the following is true regarding the Michaelis-Menten graph? Michaelis-Menten graph is a graph in which we are putting what is the concentration of the substrate. So always remember, the concentration of the substrate will always be directly proportional to the enzyme concentration. So the answer will be B. So this is a statement to be remembered. Km is directly proportional to the enzyme concentration. Enzyme concentration. Km is directly proportional to the enzyme concentration. If more enzyme, Km will alter. Sorry, yes, you are absolutely right. The answer is A. It is directly proportional to the substrate concentrations. Directly proportional to the substrate concentration. The correct answer is A. Okay. Which of the following help in explaining the mechanism of atrial natriuretic peptide? That is your ANP. That is your ANP. Okay. So ANP works by which mechanism? ANP works by which mechanism? The correct answer, my dear students, CGMP. ANP and NO, both of them work by CGMP. CGMP. Okay. So this is a point to be remembered. Okay. इसका पीडीएफ you can ask to AFMG team like महेश सर को मैसेज करो, मिल जाएगा. ठीक है. तो पहले डिस्कशन होगा, उसके बाद annotated notes दे दूंगा मैं. ठीक है. And one more thing is that 2-3 days before the exam, I'm not going to take your 5 hours, 6 hours of your time where you are revising better things. Okay, I'm not going to do that also. I'll do very quickly. Is that okay? Now, a patient with glaucoma and also suffering from bronchial asthma, which of the following anti-glaucoma drugs should be avoided? So remember, patient who is having glaucoma. So glaucoma's drug of choice, first line drug is always your beta blocker. Beta blocker. So remember this beta blocker, which drug, my dear students? Timolol. Which drug? Timolol. Now, timolol will be the drug of choice. But it is absolutely contraindicated in a patient with bronchial asthma. In the patient with bronchial asthma, because timolol blocks both beta 1 receptor and also your beta 2 receptor. Since it is blocking both beta 1 and 2 receptor, so beta 2 blocking will lead to bronchoconstriction. Agar patient is having bronchial asthma already, then what is the treatment? Then the treatment will change. That will be selective beta blocker will come first. So timolol should be avoided in this patient because it will cause broncho. No, this is not CAMP because that direct mechanism itself, the mechanism with which the secondary messenger for your ANP is CGMP. Okay, so that is a like fact-based thing. Okay, now look here, my dear students, what I'm trying to tell you is that timolol is a, so for example, which anti-glaucoma drug should be given if they ask you people? In this case, what you are going to do in the patient with asthma, and glaucoma, then what eye drops you are going to give? So the best one will be, my dear students, that will be your bitoxolol. The name of the drug is bitoxolol, will be given into the eye. Okay, so that is a story of your what is that? Timolol and bitoxolol. Let's go to the next question. A 29-year-old female with the history of hypercoagulative disorder visiting OPD for anticoagulation treatment, which of the following should be avoided in the first pregnancy? So basically, she is having a hypercoagulability. So with which means she is having a possibility of DVT. Okay, for example. Now in this time, she is having what is that? In the first trimester of pregnancy. So in the first trimester of pregnancy, warfarin is absolutely contraindicated. Why absolutely contraindicated? Because if given in the first trimester, it will lead to what? It will lead to, my dear students, something called as a fetal warfarin syndrome. What is that? Fetal warfarin syndrome. Fetal warfarin syndrome will be side effect associated with this drug. So इसीलिए कौन सी नहीं देना चाहिए? That the drug you should not be giving is warfarin. So now the problem here is that, so if they ask you in the second trimester, can we give warfarin? Yes, warfarin can be given. Okay, so why, you can ask why? The reason is very easy to understand, my dear students. Listen to me very carefully. In the first trimester, organ genesis is occurring, right? So organ formation is occurring, that will be impaired. It can lead to problems like microcephaly. Okay, now the problem, by the second trimester, organ genesis is over. If organ genesis is over, automatically organ formation is complete, so now it won't be a side effect. Okay, so this is a very, very important aspect. So the next important aspect is that heparin also cannot be used throughout the pregnancy. So first trimester, what we are going to do, what we do is that first trimester we start with heparin, second trimester warfarin, then third trimester heparin for few days and warfarin for few days. Okay, sir, why can't we just continue with heparin for throughout the pregnancy? The problem is that we can't continue because it causes one more side effect. The side effect is what? Very good. The side effect is going to be your osteoporosis. So to avoid the osteoporosis, remember that the the problem here is the osteoporosis. To avoid the osteoporosis, we are going to shift between heparin and warfarin again and again. Okay, now patient suffering from the neck and head cancer is planned to receive radiotherapy. So what we are planning? We are planning to give radiotherapy for the head and neck cancer. Okay. Which of the following anti-cancer drug can result in the increased risk of toxicity caused by radiation treatment? Remember, radiation therapy will cause one of the most important thing, that is chemo-induced nausea and vomiting. Okay, chemo and radiotherapy induced nausea and vomiting. Now, which drug can increase the toxicity? The answer is cisplatin, because cisplatin is the anti-cancer drug which is used for the treatment of head and neck cancer. But the most important aspect is that this is the most emetogenic, highest vomiting side effect can be caused by cisplatin. Most emetogenic anti-cancer drug, most emetogenic anti-cancer drug is your cisplatin, my dear students. Most emetogenic anti-cancer drug is your cisplatin. And this question itself can be asked, among the given, which is the most emetogenic anti-cancer drug? They can ask the same question also. This has been previously asked, that is cisplatin. Okay, cisplatin is a platinum related derivative compound. Okay, it is highly effective in the head and neck cancer and causes high level of nausea and vomiting. A young patient who has a familial history of bipolar disorder in his father now came to OPD with symptoms of mania. His genetics test shows positively for the recessive inheritance of genes involved in the mania. Which of the following mood stabilizer can be given him as a most effective treatment? So what is the problem he is having? Symptoms of mania. The best treatment for mania is, what is that? Lithium. The drug is lithium. Valproate is what? Valproate is a anti-epileptic drug. Carbamazepine is also anti-epileptic drug, and olanzapine is also a anti-epileptic drug, among which the best drug will be lithium. My dear students, about lithium, there are few questions which was asked. Lithium requires a therapeutic drug monitoring. Okay, it causes nephrogenic side effects. I'm talking about the side effects of lithium. Nephrogenic diabetes insipidus. It also causes ECG changes, okay, and also it can cause fine tremors, okay. Now, the most important question here is that many people makes a mistake. This lithium, my dear student, does not cause, this is a very, very important point. It does not cause extra pyramidal symptoms. It does not cause extra pyramidal symptoms. Okay, this is a very, very important point, because many people have made this mistake also in the last exam only. In the last exam, they had asked, okay, all of the following are the side effects of lithium, except many students made mistake of marking fine tremors. No, if lithium is used, definitely fine tremors can arise. But the most important point to be remembered here, my dear student, lithium is there. Now, lithium is a drug. It does not cause any extra pyramidal symptoms, and it can cause Epstein anomaly if given in a pregnant female. Okay, so the answer is your, what is that? Very good. The answer is your lithium mood stabilizer. So lithium can be given in the form of lithium carbonate and lithium citrate. We don't give the lithium metal directly. Lithium carbonate or lithium citrate. Okay, now don't mark the answer as lithium sulfate and come. Okay, don't mark it as lithium sulfate. We are going to use lithium carbonate and citrate. Okay, all right. Dystrophic calcification is seen in. Let's see. Tell me the answer. Am I audible? Just checking. So you are telling the answer is B. Okay, what is dystrophic calcification? Let's see. Okay, the answer is, okay, one student made the answer as atherosclerosis. What about others? Bharat says it is B. What about others? Others are like, भाई जल्दी बता देना यार, हमें जाके सो मतलब जो भी करना है, ठीक है. Now listen to me. Dystrophic calcification is nothing but calcium deposits in dead tissue, So in the dead tissue, if calcium deposition is seen, that is seen with the atherosclerosis. The answer is B, atherosclerosis. Now, what exactly about other these three things? Hyperparathyroidism, vitamin D disorder, and hypercalcemia. In all of these conditions, there is an increase of serum calcium. So blood के अंदर calcium ज़्यादा हो गया. In the blood, calcium is increased. Now calcium don't know what to do. Now see, because there is a elevated level of calcium in the blood, now the blood calcium doesn't know what to do. Now what is going to happen is that this extra calcium, whatever is there, it will go and accumulate in the tissues. It will go and accumulate in the living tissues, in the living tissues. If it accumulates in the living tissues, calcium deposition in the living tissues, we call it as what, my dear students? Very good. It is called as metastatic calcification. Called as metastatic calcification. So the calcification can be divided into two types. What is the two types? Yes, the two types will be metastatic and dystrophic. Any condition where serum calcium is elevated, the calcification you are going to find is your metastatic calcification. तो इसका मतलब क्या हो गया? Blood के अंदर, it means that if in the blood, if there is a elevated level of calcium, though it, since the free calcium elevated amount is there, that will go and deposit, leading to what? Leading to your metastatic calcification. Okay. All right. Let's go to the next question. So for next question, you already gave the answer. Female went for camping with her friends. She had a bee sting, which resulted in edema, redness on the face, and difficulty in breathing. What type of mechanism is responsible? The first and most important, there was a bee sting, immediately followed by the bee sting. What was there? The problem was edema in the face and difficulty in breathing. It is suggestive of anaphylactic reaction. Anaphylactic reaction is also called as type 1 hypersensitivity. HSN means hypersensitivity. In the type 1 hypersensitivity, what are the substances released? Are histamine. Histamine is released, that will cause bronchoconstriction and vasodilation. And also for this histamine release, it comes from the mast cell. On the mast cell, we have immunoglobulin E. So all the mast cell degranulation is mediated by what is that? Very good. Mediated by your immunoglobulin E. So immunoglobulin E will get activated. That will break the mast cell, leading to release of histamine, causing bronchoconstriction and vasodilation in the anaphylactic reaction. So the answer will be absolutely correct, my dear students. That is your DIgE mediated. Okay. Okay. Myasthenia gravis is which type of hypersensitivity reaction? So myasthenia gravis, my dear students, remember there are some destructive autoantibodies to what? To the NM receptor. So we have a fixed antigen. Now we know the antigen is NM receptor. We know the target. If the target is always NM receptor, if the NM receptor is the specific target, so antibodies will go and attack only NM receptor. For example, let's talk about what is that? Let's talk about Graves' disease. The target is only specifically TSH receptor. So if to a fixed target, if antibody is produced, that will be your type 2 reaction. That will be your type 2 hypersensitive reaction. Okay. Now type 5, do not confuse it with the myasthenia gravis. So type 5 is exclusively kept for what? Type 5 is exclusively kept for organ transplant, organ rejection. But again, if in the option, type 5 will, if it is not given, or many times it won't be given because it is not added into the textbook set, that is the reason it will not be given. So if type 5 is given and the option, that is for the organ rejection. If the type 5 is not there in the option, the correct answer will be type 4 hypersensitivity. So I'll tell you, type 1 is anaphylactic reaction, type 2 is a fixed antigen and antibodies are there, and type 3 is immune complex deposition such as glomerulonephritis and your what is that? Post-streptococcal glomerulonephritis and reactive arthritis. Type 4 is a delayed hypersensitivity for Montauk's test, tuberculin test. Okay. For example, you have your type 1 lepra reaction. All of them comes under type 4 hypersensitivity. Okay. And let's go to the next one. Cells responsible for the graft rejection. So remember, type 5 is a type of, again, it is a type of delayed hypersensitivity. What is it? Delayed hypersensitivity. Always remember, delayed hypersensitivity is a cell-mediated immunity. It is reaction will come as a result of cell-mediated immunity. So the cell-mediated immunity is given by your T cells. So T cells are responsible for the cell-mediated immunity. Cell-mediated immunity involves in the graft rejection. Okay. So again graft rejection can be divided into three types: acute, hyperacute, and graft versus host disease, GVHD. Okay. Neural tube defect shows which pattern of inheritance? Let's see. Very good. The correct answer is T cells. Okay. Neural tube defect shown in which pattern of inheritance? So remember, neural tube defect can be of multiple types. Okay, means what? It can come as a result of genetic, or it can come as a result of other factors like vitamin B9 deficiency. Since it is having a multi-factor, it can be genetic, it can be autosomal, or it can be your what is that? Can be due to your vitamin deficiency. Because of that, the best answer will be multifactorial. So the two diseases which can be asked for you people is neural tube defect inheritance and diabetes mellitus inheritance. Diabetes mellitus also a type of multifactorial thing. Okay. Okay. NF1 neurofibromatosis 1, the pattern of inheritance. Let's see. Let's see how many of you will tell. I'm looking at the comments only. Very good. All of you are absolutely correct. It is a autosomal dominant. It is a autosomal dominant neurofibromatosis 1 gene. It is a autosomal dominant disorder. Very good, my dear students. Very good. Very good. The answer is autosomal dominant. Okay. Let's go to the next one. Macrocytic anemia will be seen in. So they're asking again the macrocytic anemia. Macrocytic anemia will be seen in. Okay. Let's see. See, as I have told you people, sideroblastic anemia can be both micro or macro. Okay. So, anemia of chronic disease, again micro, thalassemia is again micro. The answer is chronic liver disease. Chronic liver disease will be the ruling, we are ruling out the other three options and we are marking it as a chronic liver disease. That will be the cause for macrocytic anemia. Most abundant plasma protein. Very good. All of you are absolutely correct. The answer is D. Let's go to the next one. Most abundant plasma protein. Most abundant plasma protein kaun hota hai? Which is a plasma protein which is highly present in the blood vessel. So the most abundant plasma protein is albumin. The large quantity of plasma proteins are made out of albumin. Now albumin is responsible for the maintenance of one important pressure. Maintain one pressure called as oncotic pressure. Oncotic pressure. Oncotic pressure is maintained by your, what is that? By your albumin. Osmotic pressure is maintained by your, while your sodium and other ions. Okay. Now, Benz-Jones protein. Benz-Jones protein is seen with which disease? Very good. That the decrease will lead to edema. That is the thing. Na? So that is why in the chronic liver disease, that albumin production will be reduced, because of which edema will be occurring. Benz-Jones protein is most important aspect associated with the multiple myeloma, my dear students. Okay. Very good. Very good. 10-year-old child present with the lower abdominal pain, rashes over the extremities, knees, ankles, and joint pain. Okay, what is the diagnosis? Remember one of the most important: rash, lower extremity pain, and abdominal pain. Okay, is a direct indicator of your Henoch-Schflein purpura. Henoch-Schflein purpura. Okay, so HSP is seen in the children. Okay, and already you know that lower abdominal pain, rashes over lower extremities. Okay, then there can be palpable purpura, okay, then purpura. And other important aspects is that it is a type of type 3 hypersensitivity. Type 3 hypersensitivity, because of which immune complex deposition. So the Henoch-Schflein purpura has a, one of the factor is type 3 hypersensitivity. It comes under a type of small vessel vasculitis. Okay. Okay. Cat scratch disease is caused by cat scratch disease is caused by okay. So all of you, this is a direct. Now again, you people will have, what is that, the discussion, sir. So some places say something else, some places say something else. ऐसा कुछ नहीं होता है. There are some diseases which can be caused by multiple bacteria or parasites. Okay, understand something here. some viruses, two viruses can cause same disease. For example, infectious mononucleosis. Infectious mononucleosis can occur as a result of cytomegalovirus, or it can also occur as a result of Epstein-Barr virus. Like that only, cat scratch disease predominantly occurs as a result of Bartonella henselae. Okay, Bartonella henselae. Okay, now this Bartonella henselae, my dear students, it causes a cat scratch disease in which there is a granuloma. There is a granuloma formation. The granuloma will be, my dear students, a stellate granuloma. What is it? Stellate granuloma. Stellate granuloma means star-shaped appearing granuloma. Star-shaped appearing granuloma. Okay. Very nice. Okay. Let's go to the next important aspect. What is that? Which of the following is used in the cleaning of blood spillage? Tell me. The best answer will be from PSM. Stellate granuloma. Very good. The answer is sodium hypochlorite. Very good. Sodium hypochlorite. All of you are correct. All of you are correct. Dr. A.M. Bharat, Anthony, okay, Rajput, Piyush Yadav, all of you are absolutely correct. Correct. Absolutely correct. What is the answer? C. That is sodium hypochlorite. Sodium hypochlorite, my dear students, it has a free radical. Free radical called as OCl, that is only your OCl minus, called as hypochlorite. This hypochlorite, again one more question from the pathology they can ask you, this is a most efficient, what is that? Bactericidal agent as well. Bactericidal agent. Okay, so this is also next important aspect. Okay, wow, very good, very good. Okay, so a post-COVID patient presented to the OPD with progression of black nasal discoloration. Patient was diagnosed as a case of mucormycosis. So the drug of choice for the mucormycosis is, remember, lamb. What is that? Lamb. Okay, lamb का मतलब बकरी नहीं है. That is called as liposomal amphotericin, lamb. Okay, that is your lamb. Liposomal amphotericin B. Liposomal amphotericin B. Okay, so that is only your lamb. The treatment will be your lamb. The answer is your lamb. That is option A. And this is a direct question from the, so now दोनों लोग आ जाएंगे. Okay, फार्मा वाले भी इसी के लिए लड़ेंगे भाई, ड्रग ऑफ चॉइस पूछा गया, और ये वाले भी, ENT वाले भी बोलेंगे भाई हमारे तरफ से पूछा गया. Let's go to the next one. Child with a low socioeconomic background has a foamy lesion, white spots in the both eyes, in the temporal conjunctiva, means on the temporal aspect of the conjunctiva there are some white spot, and conjunctival xerosis is present. Conjunctival xerosis is present. What could be the vitamin deficiency? The answer is very good, vitamin A. Now what they are talking, background foamy white spots in the eye. Foamy white spots in the eye are indicator of something called as, my dear students, Bitot spots. What is that? Bitot spots. Okay, Bitot spots is a clear-cut indicator of what is that? Vitamin A deficiency. Okay, so what is that? Vitamin A deficiency. Vitamin A deficiency, Bitot spots, conjunctival xerosis. There can be corneal ulcer. Okay, and corneal ulcer can also occur, and erosion of the cornea also can occur. The answer is vitamin A. So let's go to the next one. Identify the vitamin deficiency in the image. So the image is what? The next one is what? The image is Cahal's necklace. What is that? Cahal's necklace. Cahal's necklace. So Cahal's necklace is telling you what? It is a deficiency of vitamin B3. Vitamin B3. This is associated with the pellagra. It is associated with the pellagra. Pellagra is as a result of vitamin B3 deficiency. Clear? Okay. Treatment for hyperthyroidism of first trimester is, again, this is an important question. Let's see how many of you can answer. Treatment for first trimester. So remember, it's, see, if first trimester, second and third trimester, For the hyperthyroidism, first trimester always propyl thiouracil. Second, you can give carbimazole or methimazole can be given. Okay, but usually preferred one is carbimazole. Usually preferred one is a carbimazole. So for the first trimester only PTU. For the first trimester only and only, that time what is the drug of choice? PTU. Okay, because PTU cannot be used for a long period of time because it can cause one major problem, that is severe hepatitis in the mother. Severe hepatitis in the mother, but it is safe to the baby. So that is why what we are going to do, first trimester we are going to use hyperthyroidism PTU, and second and third trimester what we are going to use carbimazole and methimazole. Lugol's iodine is used before surgery, used before thyroid surgery to prevent the storm, to prevent the thyroid storm, prevent the thyroid storm. Okay, so this is a point to be understood. The answer is P. Okay. Let's go to the next question. A female washing clothes and her hands in cold water exhibit color change from red to white. What is happening? Red to white. Whenever she is exposed to cold, the hands are turning white. That means cold water is causing vasoconstriction. Cold water is causing vasoconstriction. It is an example of Raynaud's phenomena. It is a Raynaud's phenomena. Okay. So if there is a Raynaud's phenomena, the treatment will be, what is that? Vasodilator. Treatment will be vasodilator. Vasodilators are which drugs you are going to use? Calcium channel blocker. Which calcium channel blocker, to be specific? Dihydropyridines. Dihydropyridines. Okay, this is a very important point to be remembered. Dihydropyridines. Okay. Now, a patient present with a unstable angina and 325 mg of 325 mg of aspirin was given. Which is the correct mechanism of action? So, see, aspirin is there. Aspirin, my dear student, 325 mg up to, remember, 75 to 325 mg. It is what? Remember, it is a place where it is having what effect? Antiplatelet effect. This antiplatelet effect by inhibition of cyclooxygenase, which will lead to decrease of thromboxane A2, because of which there is no clot formation. Okay, so what action of the aspirin is used here? Inhibition of cyclooxygenase is used. So the correct answer is D. Okay. All right, let's go to the next question. Diabetic patient is brought with the complaints of vomiting, abdominal pain. On examination, patient is found to have hyperventilation and hypotension. Blood glucose level is 320 mg per deciliter. 320 mg per deciliter, and urine ketones is positive. So the diagnosis is diabetic ketoacidosis. What is the treatment of choice for diabetic ketoacidosis? First and most important, IV fluids. IV fluids. Followed by IV fluid, you are going to start a insulin. You are going to start a insulin. Which insulin will be the insulin we are going to use? Regular insulin. Regular insulin can be given how? It can be given IV. Regular insulin is the only insulin we can give IV. Remember, regular insulin is the only insulin we can give IV. If there is a severe acidosis, then you are going to give sodium bicarbonate, NaHCO3. Sir, all of them are there in the option. What to do? So what you are going to do is that her blood glucose is 320 and urine ketones are positive. So remember, the first treatment you are supposed to start is IV fluids, followed by that insulin will be given. Okay, first and always remember, in the diabetic ketoacidosis, the biggest enemy is dehydration. The biggest enemy is whom? Dehydration is the major deadly enemy. Okay, remember, first IV fluid, followed by that insulin, then check for the blood ketone level, IV bicarbonate, all of them can be given. So the first best answer is IV fluid. If IV fluid if it is along with insulin, then IV fluid plus insulin option will be better. If you want to choose a single best answer, first always start with the IV fluids, because there will be excessive loss of fluid and electrolyte. So we need to replace the fluid and electrolyte by giving a intravenous fluids. Understood, everybody? I knew this question you people might make a mistake of insulin drip. So first always with the IV fluids only, then you are going for insulin drip. Okay, clear? All right, let's go to the next question. what is the most common seizure found in the age group less than 2 years? As soon as I tell you age group less than 2 years, do not always think about absent seizures. See, absent seizures are the seizure which can be found only in children. It doesn't mean that is the commonest seizure. The commonest seizure, the most common seizure which can occur in the children, my dear student, that will be your febrile seizure. Febrile seizure will be the very common seizure. So what is the treatment for febrile seizure? Remember, per rectal diazepam. Per rectal diazepam can be given. Per rectal diazepam. Here again, please remember, again here, most common seizure is not absent seizure. Always it will be febrile seizure in children. Per rectal diazepam, and then followed by that to decrease the fever. Okay, this is the treatment. Then febrile. Okay, so per rectal and see, decrease the fever. And also what you are going to do is that per rectal diazepam you are supposed to give. So first treatment start with a per rectal diazepam. Okay, so ये बहुत important question है, बहुत लोग गलत कर चुके हैं. Many people have made a mistake. Immediately febrile seizure, give paracetamol infusion. भाई रुक जाओ, पहले seizure का तो treatment किया करो. If he gets the seizure again and again, that is going to be very bad for the children. Okay, so always you should start with what? You should always start with the treatment per rectal diazepam. Okay, ये भी important. IV diazepam देते हो, okay, it is very difficult to secure IV line in the children, especially during the time of seizure. So that is why we are supposed to give a per rectal one. Sir, why can't we give orally? We can't give orally because first pass metabolism. Per rectal also it will directly absorb into the circulation. Okay, let's go to the next one. Antidote for lead poisoning. Okay, so I will give you next question. A patient was found to have a lead poisoning and treated with a ball. What is the full form of ball? बाल का मतलब होता है बाल, मतलब hair, right? Hair निकाल के दे दो, हाँ ले ले भाई antidote. Right? What is ball? BAL stands for stands for British anti-Lewisite. British anti-Lewisite. Okay. British anti-Lewisite. BAL stands for British anti-Lewisite. The treatment for lead poisoning is BAL, and penicillamine is used for what? D-penicillamine is used for. It is used for copper chelation. Okay, so in the conditions such as, for example, Wilson disease. Wilson disease में क्या होता है? In Wilson's disease there is the accumulation of what? There is the accumulation of, that is your, what is that? Copper. So to remove that copper we can use a very important drug, penicillamine. Okay, so copper chelation can be done with the help of penicillamine. Okay, copper chelation के लिए penicillamine, but best drug is BAL, British anti-Lewisite. Which of the following is not given in a patient of Parkinson patient who is having a hypertension? बताओ hypertension patient को क्या नहीं देनी चाहिए? Hypertension and Parkinson patient. See, DMSA is a totally different thing. DMSA we use it in radiology. DMSA is used in radiology for the kidney functioning test. Okay. So remember, the drug which is not used in a patient who is having a hypertension and Parkinsonism, always remember the best answer is bromocriptine, my dear students. Bromocriptine नहीं देते हो. Parkinson patient के लिए, normal Parkinson patient you can consider bromocriptine, but in patient with hypertension and Parkinsonism, bromocriptine is not good. फिर कल जाके मुझे ये मत बोलना कि सर Parkinson आया था पर मैंने bromocriptine मार्क नहीं किया था because you told me so. No, I told you that bromocriptine is not given in Parkinson patient with the hypertension. Only that condition we are not supposed to give. Okay, ध्यान से सुना करो, क्योंकि this has a effect on the autonomic nervous system. ये effect है कहाँ पे? Autonomic nervous system पे effect करता है in the hypothalamus. इसलिए ठीक है, शॉक मत होइएगा. समझ गए? Okay, चलो last few questions. A 34-year-old female was suffering from SLE. अच्छा देख लो भाई, systemic lupus erythematosus. Recently started to complain of dry mouth, okay, itching in the eye, positive for ROLA antibodies. Which of the following drug will help her symptoms? Okay, bromocriptine ka the direct mechanism, how exactly it works in the in the autonomic nervous system, especially in the hypothalamus, is not known. The same effect is said to be believed in the treatment of diabetes mellitus also. It is not clearly known. We are still doing a research on that. Many institutions are doing it. Now anti-rolla antibodies are present. Rolla antibody आगे तो इसका मतलब क्या है भाई? Rolla antibodies is indicating you. What is that? Sjogren's syndrome. What is that? Sjogren's syndrome. Okay. Sjogren's syndrome के लिए earlier time में drug of choice क्या होता था? What is the drug of choice for earlier time? Earlier time में क्या देते थे? The answer used to be pilocarpine. Earlier time पे pilocarpine. But Sjogren's syndrome में 3 problems होते हैं. Dry mouth. Sjogren's syndrome will have 3 problems. Most important. Dry mouth, dry eye, and also dry vagina in the female. Now actually we don't use now clinically we don't use Sjogren's syndrome, so we have 3 separate treatments for each one of them. So for the dry mouth we use something called as sevemilin. Sevemilin is also a cholinomimetic. It is also a cholinomimetic, but for the dry mouth we use specifically sevemilin. For dry eye, we use methyl cellulose. What is that? Methyl cellulose eye drops, which is basically a lubricant for the eye. It is like a artificial tears. Okay. And for the dry vagina of a female, we are going to give her estrogen containing creams. Estrogen containing creams are advised. So these are the 3 important aspects. What is that? That is associated with the Sjogren's syndrome. In the Sjogren's syndrome, you can get Rho and La antibodies. On the biopsy, you can find glandular fibrosis. All the glands, especially glandular fibrosis. Which glands? In the lacrimal glands, in the salivary glands, and as well as Bartholin glands in the female. Okay, fibrosis. Okay, so this is a story of your, what is that, 34-year-old woman with a Rolla antibodies. Okay, let's go to the last few questions. A 27-year-old female came to the doctor with the complaints of muscle weakness, drooping of eyelids, suspected a disease, administered a drug for the disease, immediately symptoms improved. Basically, look here, complaints of muscle weakness, drooping of eyelids. So I would suggest suggestive of myasthenia gravis. For the myasthenia gravis, we do a test called as tensilon test. What is that? Tensilon test. Here what we are going to give is 10 mg edrophonium. Okay, edrophonium. If 10 mg edrophonium is given, there are 2 possibilities. Improve of the symptom, मतलब symptom disappear हो जाएगा. Improve of the symptoms. That means the tensilon test is positive. If there is a negative means no improvement of symptoms. Okay, so no improvement of symptoms. If it is positive, it confirms the diagnosis of myasthenia gravis. Okay, and if there is no improvement, it can be myasthenic crisis हो सकता है. Possibly myasthenic crisis is possible, or possibly it can be Lambert-Eaton syndrome. It can also be Lambert-Eaton syndrome. So these are the possibilities. Okay, so what actually a diagnostic test in this case? See, tensilon test itself is a diagnostic test. Okay, tensilon test itself is a diagnostic test. The name of the tensilon test, what we are going to do is give a 10 mg of edrophonium. Okay, so in this case, what happened? So in this case, what exactly happened? Symptoms improved. If symptoms improved, that means tensilon test is positive. If tensilon test is positive, that means diagnosis of the myasthenia gravis is confirmed. Okay, then you can go for best investigation of choice. We can go for single fiber EMG test. Okay, we can go for autoantibodies to the NM receptor. There are multiple other things which you would have studied from the medicine, but examiner is most interested in this edrophonium test. Okay, so the drug given was what? Of course, if the symptoms are improving, which drug was used for the testing? Edrophonium is used for the testing. Okay, So young male brought to the hospital with active seizure, prescribed a drug which act as a GABA receptor opening frequently. So what they are telling is that patient is having a seizure. For that, we are using a drug which opens the GABA receptor frequently. GABA channels are opened again and again. So the increased frequency of GABA channels opening is done by which group of drugs? Remember, the drugs are your benzodiazepines. Okay. Now barbiturates, what will they do? They increase the duration of opening. They increase the duration of opening of GABA receptor. Duration of opening of the GABA receptor. While benzodiazepines increase the frequency of the opening. Benzodiazepine increase the frequency of the opening. Okay. So this is a story of your, what is that? That is your benzodiazepine and barbiturate. Best medical management for pheochromocytoma. Chalo batao. Let's see. Best medical management for pheochromocytoma. This question is asked again and again. Many students make mistake. ध्यान से देखो, ध्यान से देखो. Look at the question very carefully. Look at the question very carefully. I know this. This is the urgency. You are making a mistake. Don't rush. Look at all the options. So remember, if the pheochromocytoma is there, now you got it. The answer is D. Very good. The answer is D. Okay. Now listen to me very carefully. So if the pheochromocytoma, if they ask you single best drug, then your phenoxybenzamide. Then your phenoxybenzamide. Okay. If the pheochromocytoma, if they ask you best medical management, always remember propranolol plus phenoxybenzamide. Because after giving phenoxybenzamide, alpha receptors are blocked, but still beta receptor effect can be remaining. That can be altered with the help of option D, that is propranolol with a phenoxybenzamide. Propranolol with a phenoxybenzamide is the best one. Okay, remember propranolol plus a phenoxybenzamide. ये पूरा एक ही ऑप्शन है भाई. सेंटेंस तो पढ़ो प्लीज, रश मत करना. सेंटेंस है ना ये, तो इसलिए इधर नीचे आ गए हो. Okay, so best medical management for pheochromocytoma is propranolol. Propranolol, is it correct? No, propranolol plus phenoxybenzamide. Again, I am telling you, if single best drug is asked, phenoxybenzamide. Again, I am telling you, single best drug, if it is asked, phenoxybenzamide. If best medical combination is asked, propranolol plus phenoxybenzamide. Okay, best treatment will be surgical treatment. Any confusion, please do let me know. Right now, I will clear this. No confusion. If best medical management, combine propranolol with your phenoxybenzamide. Okay, all right. Again, this question was asked, and this was also very repeated, frequently asked question. Okay, look here. A 74-year-old male came to the hospital with a history of hypertension, recently diagnosed with a diabetes mellitus. So what exactly? Hypertension with diabetes mellitus. Phentolamine is used in clonidine withdrawal cheese reaction. Clonidine withdrawal and cheese reaction. Clear, Rajput? Okay. Okay. Okay, diabetes with hypertension. After taking the drug for certain time, patient is suffering from a dry cough. Dry cough is a side effect of which group of drugs? ACE inhibitor. ACE inhibitor causes which is that dry cough. Because they inhibit the ACE. If they inhibit the ACE, if ACE is inhibited, which will lead to increased amount of bradykinin. Since there is an increased amount of bradykinin, that will lead to dry cough. Okay, so this is the answer, ACE inhibitor. The answer is ACE inhibitor, because after taking the drug for some time, he got what is a dry cough. Now diabetes patient with hypertension, best drug what we can use is ACE inhibitor or ARBs. Very good answer. ACE inhibitor or ARBs can be given for a patient with hypertension and diabetes. Okay. An adult patient came to the doctor for the retinoscopy. Doctor decided to give him a mydriatic which causes cycloplasia but has a short duration of action. So remember, shortest acting anticholinergic drug is your tropicamide. Atropine is used in whom? Used in the children. Okay. Now all the four drugs will cause mydriasis. Yes, they will cause the mydriasis. They will cause the very good. They will cause the mydriasis, but with cycloplasia. With what? Cycloplasia. Okay. Cycloplasia are also called as, these are also called as a passive mydriasis. It is also called as passive mydriasis. Okay. Passive mydriasis. Remember this point. Passive mydriasis is caused by what? Cholinoblockers. Okay. So then what is there? We have something called as active mydriasis. Active mydriasis. Active mydriasis means there will be no cycloplasia. No cycloplasia. If there is no cycloplasia, active mydriasis, this will be caused by your a drug called as a phenylephrine. Okay. And in the children we use atropine. But the correct answer for the adult patient is always tropicamide, because if you use that atropine in the adult, so what will happen? He will lose the near vision for about 10 to 12 days. Okay. And an experiment, in the presence of alpha blocker, adrenaline was injected. If you give adrenaline, what can be expected? In the presence of alpha blocker, means alpha receptor is blocked. Now you give adrenaline, right? Now adrenaline will go and act on the beta 1 and beta 2. Now beta 2 will cause what? Vasodilation. Vasodilation means it will decrease the BP. Yes. And also vasodilation is an option. And beta 2 stimulation. Beta 2 directly causes what? Beta 2 stimulation will cause bronchodilation. So alpha effect is not there. The alpha effect is not there. The answer will be all of the above. So remember, all of the above. So in the presence of an alpha blocker, what will happen? The BP will decrease and bronchodilation will occur. So this is also a PYQ which was asked last to last exam. देखो ध्यान से पढ़ो ना, डिक्रीज ऑफ बीपी क्यों कम हो रहा है? वैसोडाइलेशन की वजह से, है ना? Adrenaline दोगे तो bronchodilation तो automatically होगा ही होगा. So all of the above. So what I have done here is that I have mixed and matched with the same meaning but different words. Okay, all of the above will be correct. Most potent opioid. This is a very favorite question of examiner. Most potent opioid is always fentanyl. It is a type of synthetic opioid. It is a type of synthetic opioid. The correct answer is fentanyl. Correct answer is very good. The correct answer is fentanyl. This is asked very many times. Okay. So this is morphine is a prototype opioid. Morphine is a prototype opioid. They are interested in most potent opioid. Okay. Antidote for atropine overdose. What is the treatment for antidote for atropine overdose? Pyridostigmine, neostigmine, physostigmine, all of the above. See, the best answer in here, best answer is physostigmine, because physostigmine will cross the blood-brain barrier. Atropine also cross the blood-brain barrier. So in the brain also we will get the effect only if we use physostigmine. Pyrido and neostigmine, these two drugs, no crossing of the blood-brain barrier. Okay, very good answer. Answer is C. Okay, so the answer is C. Atropine also crosses blood-brain barrier. This also crosses blood-brain barrier. Okay, very good. Let's go to the last question. Which of the following can cause drug can cause gynecomastia? All of you know from the disco. D for digoxin, S for spironolactone, C for cimetidine, S for spironol. Okay, DIS, S for spironolactone, C for cimetidine, O for your estrogen. So the answer is gynecomastia can be caused by all of them. Okay. So whatever points I have told you people in today's class, definitely. Now don't sit for preparing from this prayer, like what is that, this PDF. Okay, we'll share the PDF, but don't wait for the PDF to prepare. Now you just continue with your preparation. For you, today's quota of PYQs I have done it for you. Okay, all right. Now from this question, at least I can guarantee you, you gave me 1 hour, right? 1 hour 15 minutes. For your 1 hour 15 minutes, I can guarantee you at least 3 to 4 questions from this, guaranteed. 3 to 4 questions guaranteed. Okay, not just the same questions will never come. Okay, but based on the points which I have told during the exam, like during the discussion, that is there. Okay, I don't know about other faculty. Yes, I do tell it with a full confidence, because I mean my work. Okay, I believe in that and I believe in you people. You people please focus on your studies and अभी ध्यान से सुनो. अब परेशान मत हो ना सर, इतने 3 दिन में 19 सब्जेक्ट कैसा पढ़े. अरे इतने दिन पढ़ते आ रहे हो तो हो जाएगा. These many days you have been studied, so do not worry. Okay, and do not try to recall everything at once. Now if you close your eyes, you will not be able to recall the notes on a page by page manner. You will never get. Thank you so much, thank you so much. Now listen to me, you'll never get. आंख बंद करने से यार मैं मतलब इतने सालों से कई चीजें पढ़ाते आता हूँ ना. इवन इफ आई क्लोज माई आईज आई विल नॉट गेट द थिंग्स इन माई लाइक इन फ्रंट ऑफ माई आईज इमीडिएटली. वैसा नहीं चलता है भाई. दिमाग मतलब मूवी नहीं बनाती है. ठीक है. सो व्हाट यू आर सपोज टू डू व्हेन यू रीड द क्वेश्चन, व्हेन यू लुक एट द ऑप्शन, देन योर दिमाग विल टेल अच्छा ये वाले ऑप्शन है भाई, यहाँ पे पढ़ा. So that is how you should let your brain to work. You should not let your brain to do like oh my god मुझे याद नहीं आ रहा है. अरे डरो मत, याद आएगा. थोड़ा शांत रखो. Please, I beg you people for this. Okay, I have seen many times this is happening. Okay, this is the rule number 1. Rule number 2 is that अब जो कर रहे हो उतना ही करते जाना. Do not stop or do not do extra. जो कर रहे हो उसी हिसाब से चलो. Now do not make yourself pressurized. On the internet you have a lot of video sources available in the YouTube. So for that what you are supposed to do is that, for example मान के चलो कोई एक subject था, you have never studied, you have never ever studied that subject. तो उस सब्जेक्ट के लिए कहीं पे भी शॉर्ट वीडियोस है तो देख लो, उसमें गलत नहीं है. मतलब वन लाइनर करवा देते हैं या मतलब दिल मेक यू रिमेंबर द पॉइंट, ऐसा कहीं पे मिलेगा. लास्ट मिनट रिवीजन कर लो, उसमें गलत नहीं. बट दैट इज डन फॉर द सब्जेक्ट व्हिच यू हैव नॉट डन एट ऑल. ओके, पर इसी के ऊपर डिपेंड मत करो मैं 19 सब्जेक्ट वही चीज करूंगा, दैट इज गलत. ओके, look at your notes, okay, look at the images and notes को जल्दी जल्दी ऐसा करो, ऐसा पेज देखा ऐसा आगे बढ़ो. और अरे हमें याद होनी चाहिए कैसे, अभी पिक्चोरियल मेमोरी. तुम्हें ये करने की जरूरत नहीं है कि मतलब मैं अभी रिसर्चर बन जाऊंगा. नहीं भाई, तुम्हें एग्जाम पास होना है. ठीक है, बस ये मतलब स्पाइरोनोलैक्टम लिखे थे 3 times you have seen. On the day of exam you'll remember spironolactone for no doubt. Why? Because picture memory has been formed. You get my point? इतना स्ट्रॉन्ग है. ठीक है. एंड दूसरी चीज है कि अब नया नया सर्कस मत किया. मतलब मैं इधर से वो करके उधर से वो करूंगा, ये लाइक डू नॉट डू एनी न्यूअर सर्कस ऑफ डूइंग unnecessary things. It's my request for you people. And on the day of exam, my dear students, whoever is there, yes, I will share that. Do not worry about it. Please, my dear students, whoever is attending this live, please listen to me. भाई लोग, मैं मतलब I request you people, on 19th night, try to sleep. Don't stay awake the whole night. मुझे भी पता है you'll not get sleep. मुझे भी पता है you'll not get sleep. But at least give your body physical rest. आंख बंद करके चुपचाप सो जाओ. ना फोन, ना यूट्यूब, ना नोट्स, कुछ भी नहीं देखना है. सो जाओ. If you can get up, please get at least 4 to 5 hours of sleep before night, because फर्स्ट पेपर तो ये हमने मस्त कर दिया. ठीक है, उसके बाद दिखाई देगा भाई दुनिया का पूरा स्ट्रगल तुम्हारा चेहरे पे दिखेगा. मैं जब भी जाता हूँ ना एग्जाम हॉल के पास से, मुझे इतना इतना मतलब आई फील बैड अबाउट लुकिंग एट ऑल माय स्टूडेंट्स, बिकॉज कि मतलब इतना वीक हो जाते हैं, खाए नहीं कुछ नहीं. अब ऐसा लगता है कि यार ये अभी गिरेगा यहाँ पे. उतना वीक हो जाओगे बाय आफ्टरनून सेकंड पेपर. सो इट्स माय काइंड रिक्वेस्ट टू स्लीप. Okay, and on the morning of exam, and again I'm requesting you people, do not skip the meal. भाई दिमाग काम करने ना, उसको एनर्जी चाहिए, ग्लूकोज दिया करो सफिशिएंट अमाउंट. ठीक है, बाइक में मैं बोलते आया हूं ना, ग्लूकोज इज इंपॉर्टेंट. दो ग्लूकोज. ठीक है, अच्छे से. ओके, सो दिस आर सम इंपॉर्टेंट एडवाइसेस आई कैन गिव यू. एंड अगर अगर आपको ऐसा लगता है मुझे अब ये हो रहा है, चेस्ट पेन आ गया, मुझे डर लग गया, ये आ गया वो आ गया, कुछ नहीं. एक बार शांत से सोचना. तुम्हें चेस्ट पेन भी आएगा, तुम्हें कुछ भी आएगा, तुम्हें एंजाइटी आएगा, फियर आएगा, तुम कुछ भी आने दो. whatever you get at the end of the day, on 20th you are going to give the exam. So when you know this is the end truth, do not fake yourself. Do not let yourself played by your feelings. It's again my request. Many people, I don't know, okay, why people do this. अरे यार कोई, there is no option, you are going to sit in the exam. So when we know the truth, let's stand with it. हाँ, okay, I will give the exam. अब डरने से कोई मतलब नहीं. एंड एक बार खुद को बोलो, हाँ भाई कर लूंगा कर लूंगा. अरे जिंदगी में इतना सारे परेशान झेल लिया. You have managed to come your life by like doing a lot of things. ओके नाउ एक एग्जाम से कौन डरता है खुद को बोलो ए संभल जाएगा आई कैन डू इट मैन नो प्रॉब्लम ఏం కాదు చేసుకుందాం కాన్ఫిడెన్స్ okay so always keep that and with that being said I'll leave you people. I'll not waste even 1 second of yours. This is a very very important and crucial time. Okay, thank you so much and I will share it with Mahesh sir so you can contact with our FMG team and get the notes. Okay, थैंक यू सो मच ऑल द वेरी बेस्ट एंड आप लोग मतलब बोल रहे हो ना कुछ नहीं अब बहुत चीज झेल लिए ये भी एक झेला बस इतना ही we have managed to look at many things and manage many things in our life. This can also be managed. All is well this. Okay, all right, thank you so much guys, bye bye. Anytime I'm always with you people हमेशा के लिए ऐसा नहीं हमेशा always we are there for you. Thank you, bye bye.